Welcome to NMS. A lot of people in my lives and even in comments ask me about testosterone and how to deal with low testosterone. Now, me being a natural bodybuilder, having many years of experience with natural bodybuilding and being 50 years old, obviously people want to know, do I use TRT and so forth? No, I don't use TRT, okay? But I am aware, obviously, that testosterone can be a problem as you get older. And so I'm going to go through a presentation on how to deal with low testosterone, and hopefully this presentation can help. So basically, low testosterone or hypogonadism can be caused by a variety of medical, lifestyle and environmental factors, and is typically classified into primary, secondary or functional causes. Now, primary causes originates in your testes, so your testes can't produce enough testosterone despite signals from the brain, okay? Different diseases can cause this. Klinefelter syndrome, which is a genetic condition where you've got XY chromosomes. You've got undescended testicles, which obviously causes a problem with the testicles being able to actually go and produce testosterone through the fact that they're actually unable to actually expand. Okay, testicular injury, in other words, some sort of trauma, maybe an injury to it, you've been kicked, maybe an accident of some type, maybe you're some sort of tradesperson and you've had an accident with a tool. For whatever reason, you've got an injury. Okay, mumps, okay, so mumps could have caused it. So if you had mumps when you were younger, that could have caused problems with whether you produce testosterone or not. Chemotherapy or radiation therapy, and testicular cancer and the surgery that goes with that. Now, secondary hypogonadism is a problem in the pituitary gland or hypothalamus. Excuse me. The brain's hormonal control center. The testes are actually healthy but not being stimulated properly. Now, this could be pituitary tumors or surgery, hypothalamic or pituitary disorders, chronic opioid use, in other words, like, painkillers that are opioid based, obesity, okay, steroid, glucocorticoid use, head trauma, okay, in other words, maybe you've had some sort of injury to the brain, in which case it's just caused problems with the pituitary gland. Kalman syndrome, which is basically you didn't actually go through full puberty, and functional or age-related or lifestyle-induced hypogonadism. In other words, you're getting older, or because of lifestyle factors, you're not producing testosterone anymore. Now, often reversible or lifestyle factors are the following. So obesity, so visceral fat increases aromatization, more estrogen, that suppresses testosterone. Type 2 diabetes, metabolic syndrome, chronic stress or elevated cortisol, poor sleep or sleep apnea, excess alcohol, malnutrition or rapid weight loss. So even if you go on, let's say, some sort of diet where you're trying to lose body fat but you do an aggressive cut, that can actually decrease your testosterone. Sedentary lifestyle, okay, and overtraining syndrome. In other words, especially with endurance athletes, but can happen in bodybuilders, you're training too often and you reduce your testosterone levels. Medication-induced causes, so that certain drugs can suppress testosterone production, including opioids, glucocorticoids, prednisone, anabolic steroids, abuse, long-term suppression, chemotherapy, as already mentioned, and antidepressants, some types, spironolactone, ketoconazole, and anti-androgens, okay? So medications can actually have a part in reducing your testosterone levels. Age-related decline or andropause, starting at around age 30, your testosterone drops by about 1% per year, may or may not cause symptoms, and can be exacerbated by poor health, stress, or weight gain, as already mentioned. Now, the diagnosis, generally what they do is they go and put you through a series of blood tests, so total testosterone, free testosterone, luteinizing hormone LH, follicle stimulating hormone FSH, and prolactin. Imaging, if secondary hypogonadism is suspected, in other words, your pituitary gland, they'll probably do a scan of your brain to see if your pituitary gland has been damaged or as enlarged, maybe you've got a tumor growth. Okay, now healthy testosterone levels drop with age. Okay, so generally speaking, anything above 300 is not below normal, right? Now you're generally going to be about 600 to 700 at the age of 20, all the way down to 300 to 350 when you're about 80 plus years old. Now obviously it's going to go down as you get older, but they will give you potentially testosterone treatment if you are low. Okay, now symptoms of low testosterone: fatigue, low libido, erectile dysfunction, loss of muscle mass, loss of strength, which also goes with the loss of muscle mass, increased body fat, depression or irritability, reduced bone density. Okay, now obviously some of these things you're going to notice. Reduced bone density is probably something that you would have to have a scan to see. Okay, now to be considered for TRT, you're going to have to be below 300 over 2 tests about a week to 2 weeks apart. Some guidelines say less than 264, and your free test has to be less than 50 to 65, okay? And this also has to be combined with symptoms as mentioned earlier, okay? Non-TRT methods to improve testosterone levels. So resistance training, okay? Increases anabolic hormones like testosterone, especially when you're using large compound movements. High intensity interval training, I say it's a HIIT training, cardio, that can also increase your testosterone. Getting enough sleep, 7 to 9 hours a night, okay, helps with testosterone and reduces your stress levels. Chronic stress or cortisol, so if you can reduce your stress levels, don't stress about things obviously you can't control, that makes a big difference. Healthy fat intake, so monounsaturated and polyunsaturated, because testosterone, the base molecule cortisol is actually also cholesterol, which then becomes cortisol, which then becomes testosterone, is made from fatty acids. Now, so if you're having low-fat diet, that can actually lead to low testosterone. Okay, maintain a healthy weight, body fat percentage. Obesity lowers testosterone, as already mentioned. Avoid excess alcohol, because that can impair the Leydig cells and, you know, reduces obviously or increases your stress. Okay, chronic alcohol consumption. Cold exposure can actually help with raising your luteinizing hormone. Vitamin D supplements. Vitamin D is linked to higher testosterone via support of the Leydig cells. Zinc intake, so 30 to 50 milligrams per day. Ashwagandha is a very good herb. I'm actually using it at the moment. I'm finding it quite good. Fenugreek, which can inhibit the enzymes that convert testosterone to estrogen and DHT. D-aspartic acid, which can stimulate the release of luteinizing hormone. So obviously if it's secondary, maybe that can help. Okay, magnesium can increase free testosterone, so 700 to 800 milligrams a day for an average adult male for 4 weeks actually improved it. Now, forms of testosterone replacement therapy, okay? So injectable testosterone. So obviously that's with cypionate or enanthate, 50 to 100 milligrams a week, or 100 to 200 milligrams a week, generally, depending on how much you need. Has a long half-life, can be injected every 2 weeks. Okay, transdermal, so gels, creams, 25 to 100 milligrams daily. Okay, shoulders, upper arms, provides steady absorption. Okay, shoulders, because there's a lot of there is actually androgen sites in your shoulders. Transdermal patches. Okay, so testosterone patches. Okay, 2 to 6 milligrams applied nightly. Okay, they can cause irritation. There is actually gum adhesives that you can use, 30 milligrams applied to the upper gum. These cause a little bit of apparent discomfort, so, you know, probably not the best thing. Pellets, okay, so these are actually injected, 600 to 1200 milligrams implanted every 3 to 6 months, depending on your levels. Long lasting, but unfortunately requires minor surgery. Oral testosterone, so that can be undecanoate, you know, obviously different sort of oral ones. Now these can actually cause liver toxicity, so they're not actually as common. The most Common ones are actually your cypionates or your nanthates, okay? So in other words, injectable ones. And a little bit less common is the creams or gels, okay? Now, dose is always individualized based on symptoms, and based on blood levels. So if your blood levels are high, they're not going to give you large amounts. They're going to give you small amounts because they don't want you too high. And they're also going to monitor your testosterone levels, hematocrit, PSA, which is, the hormone that's actually involved in causing swelling of, it's actually the sort of antibody factor for your prostate gland, okay? So additional considerations before TRT, doctors will typically rule out reversible causes. In other words, if you're obese, you're on medication, sleep apnea and so forth, obviously they want to fix those things before they can actually go and put you on any sort of treatment. They want to evaluate your pituitary gland to make sure that that's not a problem. You don't have a tumor which is affecting maybe your Leydig cells and your pituitary gland, your luteinizing hormone, and causing you to potentially be low in testosterone. So you're not stimulating your Leydig cells and producing testosterone. They're also going to assess your contraindications, potential for prostate cancer, high hematocrit, or severe heart disease. Okay, so you don't want to have testosterone increasing your red blood cell count and causing potentially more chance of heart attack. Now, they're not going to give you TRT if your levels are above 350 to 400. They're not going to give it to you if there are clear symptoms, or they're going to reduce it, and they're not going to give it to you with contraindications, okay? It's highly beneficial to get TRT treatment, but obviously you want to go through what you could reverse first and see if that can't fix the problem before we start looking at TRT. So in other words, weight loss, vitamins, minerals, and then obviously, exercise, weight training and so forth. If you drink alcohol, obviously reducing your alcohol consumption. If you're on drugs, suppressing your testosterone levels, your opioids and so forth, then they've got to look at that before they ever give you TRT. Okay. Now, common side effects of TRT: acne, oily skin, increased red blood cell count or polycythemia, increased or raised risk of blood clots, strokes or heart attacks, sleep apnea, breast enlargement or tenderness, gynecomastia, shrinking of the testicles, reduced sperm production, okay, because you're reducing your own output, mood changes including aggression, irritability or anxiety, hair loss or male pattern baldness, okay, especially if genetically predisposed. Fluid retention may lead to swelling in the ankles or legs. Now, obviously, if there's fluid retention, they're going to go through the checks on your heart to make sure your heart is healthy, because you don't want to cause someone a heart attack through medication. Potentially long-term risk, okay, still debated. Cardiovascular risk. Now, I've actually read articles where it says that it decreases your risk rather than increasing it if you bring your levels to normal. But obviously, if you have too much, that can be a problem. Prostate health concerns. So obviously, if you've got a risk of prostate cancer, they're going to, as said already, they're not going to give it to you. So prostatitis, prostatic hyperplasia or BPH, okay, liver toxicity. So obviously that's more the oral forms of testosterone, but they're not used as much these days. Now, other rare ones, blood clots, okay, deep vein thrombosis, that obviously more red blood cell count, liver damage with certain oral forms, already mentioned, and increased risk of aggression or mania. Rare in most patients, but if you give people some, maybe that really makes them quite aggressive and can lead to mental health issues, okay? Monitoring and management. TRT should always be monitored by a medical professional, doctors, okay? They monitor your TRT, they monitor your PSA, they check your hematocrit levels or your red blood cell count, and they also adjust your dosage depending on what your lab results say. Now, total and free testosterone are the things they monitor. Hematocrit, PSA, lipid profile. So, if you're starting to get high cholesterol levels, they're going to adjust your levels, okay? So, and that also depends on the delivery, okay? But obviously, if you're also having problems with your liver function, okay, so all your different sort of amino acids, sort of aminos within your liver, okay, they're going to lower your dose or potentially stop it. Estradiol, so if you start getting estrogen, maybe they have to do something about that, okay? So men should use caution or avoid TRT. Men with active or recent prostate, okay, so or breast cancer, men with uncontrolled heart failure, men with untreated sleep apnea, those trying to preserve fertility, and men with hematocrit greater than 54%. So basically, guys, what I'm going to conclude with here is when prescribed appropriately, TRT is safe, okay? But you've still got to obviously monitor what's going on and make sure that, you know, you're doing it correctly. Don't self-medicate if you think you're low, because if you're using too much, you're actually going to create more problems than you think you're actually helping, okay? Now, what I'm going to add to that is that if anyone ever comes to me and they say, I think my testosterone is low, and I see a person who's obese, drinks alcohol, and they're on different medications, I'm not going to suggest going to the doctor and getting their testosterone levels checked. As someone who looks after someone's health, I'm going to suggest to them, let's see what happens when you lose body fat, lose weight. Let's get you off the alcohol. Let's try to get you off all your medications that may be causing it. And then once we do that, then we can start looking at whether, you know, if it's still low, maybe you go to a doctor, they go through the testing protocol, and they start to increase your testosterone levels. But guys, this is not a muck around thing. This is not something you just go, cool, I think I'm low, I'm just going to start injecting test, and because, you know, I want to be stronger, I'm 40 years old and I want to feel like I'm 20 again. You know, it's about health. Testosterone treatment is about health, and if you're doing it just for vanity purposes, testosterone in large doses can actually create more problems than it's actually probably going to cure. Okay, that's all I need to say about that, guys. If you've got any comments, by all means, ask away. I'm going to actually do another one, another talk about testosterone, but I'm going to talk about it from how it's manufactured by the body, from your cholesterol, and how you can work on your diet in order to fix it. If you want any of this information, I've actually got a PDF that you can actually, I will give to you. If you subscribe and comment, say comment in and subscribe to me, I will send this to you for free, and leave your email address and I will actually send it to you. Okay. I'm going to do a number of these videos with educational sort of content. So subscribe to me. It'll be one of the best things you did to find out information on how to get healthy. Okay. If you're interested in coaching, I also do that. Leave a comment if you're interested in getting me to coach you. Thanks for listening, guys, and I hope this was educational for you.